Well, we have another big crowd today. Thank you all for joining us. It is nice to see each and every one of you. Although I can't really do that because most of you don't have your video turned on, but that's okay. It's all good. Does anybody notice anything different about me if you were here last time? Hint. I got a haircut for the first time in 3 months. It was a really big day for me. When you have short hair, you usually get it done every month. So I'm feeling much better today. And I hope you all are feeling really good about where you are in the midst of this crisis. It's been just a crazy time. And every week brings something new. And in case you don't know, I'm in Florida. I live in Winter Park, Florida, and Florida reopened this past week. And so phase 2 is in some respects even crazier than phase 1. Look out if you're venturing out. But seriously, I do hope you are all doing well and managing what you need to for your organization, your constituents. And today, we'd like to talk about your plans for reopening. What are you thinking? Where are you? What questions do you have? And what resources do you have to share with each other on this topic of reopening vision rehabilitation or educational services? I'm aware that those organizations who are Ability One affiliated or have state use programs may have been working all the way through this crisis, but those of you with vision rehabilitation or vision specific education services likely shut down and are now thinking about reopening. Maybe somebody already has. In fact, I'd like to open up with a poll question. So Wendy, can you share our very first poll?
Yes, I can.
So, reopen in progress. When is your organization planning to reopen facility-based vision rehabilitation or education services? You've got 4 choices there. We did actually ask this question last week, but I think it's changed a little bit. Give you just a moment to complete that. It is a real pleasure to see so many of you here. I think we have a few people who this may be their first time. Good. Hi, Diane. Okay, so I'll let you finish that, but I'm going to keep talking and we'll start our discussion. So we have spoken to a few organizations, members who have already developed a reopening playbook, I'll call it, and we're happy to share at least one example of that, right, Wendy?
Yes, we have several.
We have several. And does everybody know how to access the information that we're talking about today? We've got some things to share with you already. And Wendy's going to give you the link to that access so that you can access that. But also, if you have any documents or resources to share along those lines, if you would please email those to Wendy and she can add them to that resource. So what is the link for that, Wendy?
I can put that in our chat for everybody.
Great.
I'm going to put my
Okay.
email address there first.
Okay, good. So please reference that. And the answers to our first poll. So 10 of you, 18%, have already started offering facility-based rehabilitation or educational services. 11 of you are planning to do so sometime in the next 30 days. 14 of you in the next 3 months, and 20 of you are still not yet sure. So that gives you some idea. And we had 55 participate in that poll, so that's great. Okay, so I will open it up for discussion and questions. Will you please let me know either by raising your hand or in chat if you would like to express a topic that you'd like to discuss or a question you have.
Jennifer Pandolfo has her hand raised.
Great. Let me see. Oh, there we are. Okay. Great. Jennifer, go ahead. What is your question?
So my question is, for those people who are already open and return to center-based programs and activities, what are some of the things that maybe you've found or some pitfalls for some of us who haven't yet opened to be aware of?
Great question. So the 10 of you who said you're already open to offering some services, if you wouldn't mind sharing what challenges, pitfalls the rest of us need to be aware of.
So I can go. My name is Julie Parrish, and I'm with Wayfinder Family Services in California. And we actually never really stopped services. We run an apartment. Well, personally, I run the Hatland program up in Northern California, and we run an apartment living program where we teach living skills, financial management, technology, Braille, and O&M. And basically what we did is we just, we gave everybody the option because we are teaching them how to pay rent. They pay rent directly to the landlord. So we gave our folks the option to either stay at the apartments knowing that they're going to have remote services, or if they felt like they needed to go home to loved ones, that was fine too. And so April or March 16th, everyone started moving out. And then around the 17th, technically, is when we really just kept going with our schedules. And so, I think the only hiccup that we've come to is the living skills. I work with younger adults. So those folks who are home with their parents, they don't have the luxury of like going out to buy supplies for a cooking lesson. They feel kind of awkward asking their parents to take them out because they've been living on their own. So kind of like working with the families as far as like living skills goes. And then, with the O&M, my O&Ms have been able to Google map the majority of where people live, but there's also a handful of people that maybe have never walked their family's neighborhood. Yeah. So to send them out, like, it's almost like we need a family member to kind of help out in the O&M lesson first and kind of go around the neighborhood with them a couple times until they're able to do it on their own. But we're doing everything over Zoom and FaceTime and over phone, and the technology classes are going beautifully. The students seem to love it. My tech guy loves it.
So Julie, yeah. How are you managing physical distancing and assuring that the staff that are working with the residential students there, so that you do have some that are staying there, right?
Yes. And so this is the first week that, like yesterday, my O&M went and met with a couple people. And so, but these two gentlemen, they actually have low vision. And so they were more so reviewing O&M lessons that they already had, and she followed behind in a car. Obviously she's wearing a mask. She didn't go technically in their apartment to get them. We met them outside. So we're taking those kind of precautions. And then I have a Braille instructor that will go and meet with them, but she's sitting 6 feet across. They both have masks on. Mm-hmm. And they're meeting in an area that's been cleaned. All surfaces have been cleaned. And so we're taking those type of precautions, but that's, we're only doing that with a handful of people. Other than that, like for Braille, we're sending out packets and then doing the assignments with them over the phone.
Okay, awesome. Thank you for sharing.
Yeah.
Does anybody have a comment related specifically to this? Otherwise, I'll move on to the next question. But this is I think something that's in the minds of many of you. So if you have something you'd like to add on to that.
Brooks Harkin has her hand raised. I'm not sure if it's about this
Yeah,
topic.
is it about this, Brooks?
Slightly. It's a variation of a question.
Okay, go for it.
Let's turn my camera on. So in South Carolina, we just have started reopening as of this week. And my question is for the organizations that have reopened, what are precautions that you're taking in regards to how many individuals you're allowing in your facilities? And then also, are you taking, precautions in regards to a conversation we had with temperatures, transportation, that sort of thing? How are those playing into how you're letting clients and then other individuals, if any, in the building besides staff?
Go ahead, Julie.
Okay, so I wasn't sure if you guys wanted me to answer that. Okay, so for the Braille instructor, she is having them take their temperature just to be safe. And looking at some of the documentation, they're actually saying that you should double up on mask. Not everybody has like the N93 or 95 mask. So usually if they don't have like the right mask, we're going to ask them to at least double up on the mask. And then somebody also wrote, our staff resistant to coming. And so I'm actually having a staff meeting today. And one of the questions is, what do you feel comfortable coming back to? So I've actually had staff come to me and say, I'm comfortable going in and meeting with so-and-so at 6 feet apart with surfaces cleaned. And so I'm kind of taking it on a case by case because, everybody has different situations. They might live with an elderly person. And so you just have to, I think it just depends on everyone on an individual basis. I don't know if I answered the question or not.
Well, that's good. Is there anybody else like to offer an answer?
Somebody would like to offer an answer. Angelic Hall.
Yes.
Great.
Hi,
Go
this
for
is
it, Angelic.
Can you hear me?
We can.
Okay, sorry, I didn't know if I pushed the button right. I'm Angela from Traffic Association from the Austin Lighthouse in Texas. And we've
Welcome.
been during the pandemic because of our hand sanitizer that we're sitting out across. With people coming into our facility, we do have pre-screening. Everybody has to have their temperature, and all visitors have to wear masks at all times, even though our employees, we're now having the option where you can or you can't because everybody is spaced out. And the one thing that we have incorporated is also we have UV lights that at the end of the day, when there's not anybody there, we have UV lights that are placed in every office or in the work areas to sanitize that whole environment.
Oh,
Make sure
wow.
our employees stay safe.
That's
And then
great.
especially for our deaf blind, when we have to communicate, because it is a tactual and the social distancing is hard. So therefore we incorporated gloves and masks for that. That's kind of how we've had to adjust. It's very different, with the culture where we have, a lot of individuals who are blind, visually impaired and deafblind, and keeping that spatial distancing within the work environment. But that's what we've had to incorporate.
Great. Thank you. Anybody else care to comment on that?
Somebody is asking if you could give us the source for the UV light you're using.
Angelic?
Hi. Yes, I can get that. Just let me know how I would share that.
You can type it in the chat, or if you have it now. If you don't, then you can email it to Wendy and we'll get it out.
We'll definitely do that. Okay.
Okay, great. Thank you. Okay, Wendy, do we have another question?
We have tons of questions coming in late.
Good.
Lots of questions.
Where is it?
What cleaning products are people using for optometric equipment and lenses?
Awesome. So those of you with low vision clinics, have you an answer for this? What cleaning products are you using for your particular ophthalmic equipment? Maybe we don't have anybody on with low vision clinics other than whoever's asking the question. It's a great one though. All right, we will seek the answer to that question and get it out in an email. How about another question?
Next question. How are you managing situations if staff are resistant to returning to work? There's a similar question, how are you managing it when consumers are reticent to coming to in-person services? So staff and consumers.
Has somebody would like to offer suggestions for that?
It's Deborah from Canada.
Hi, Deborah.
Hi, how are you, Lee?
Good.
Good. So we started a little while ago. I started a while ago talking to staff, and then I attended a legal webinar on return to work and refusal to work issues with respect to COVID-19. And it seems from that webinar that we're doing the right thing, which is that heightened level of communication with your staff prior to reopening so that you can get everybody's feelings out on the table, get a sense of where they're at beforehand. So it's a good way to know, for you to get that information. And then it's been helpful for me to know where my staff stand, but also in order to be able to plan so that they begin to get used to the idea that we are going to have a physical space reopening, but what it will look like, we're not quite sure yet, and it definitely will look different than it has looked in the past. We've already learned how much we can deliver remotely, so we're not going to let go of that. I've been really clear with that messaging. And there are some staff who want to come back for some part of their week, who need that, have been locked up with their families, and they want a chance to go back to the office some of the time. So we're starting to work out a part-time, a slow ease in, but that's all based on these conversations. I think that's the most important thing that I'm hearing. That's communication prior to is a way to break down that resistance. And the legal webinar also talked a lot about fear. People will do things out of fear and not based in reality. So the more information and facts and actual evidence that you have on hand for what is safe and what will work, the more reassured staff will be that you're there to that you are going to take care of them and make sure they're going to be okay on site. And yeah, so those are the two big things.
Thank you. Anybody else? Laura.
So we were really careful to be inclusive of our staff all along since we were out. We had once a week meetings with all the staff, and we had a meeting every single day with the senior staff. Our board stepped it up too, and we had meetings every Monday night with them. So there was a lot of communication. That's one of the things that I had heard about too on the sessions that I had attended about returning. So we have let the staff who feel uncomfortable with being back stay home, and they're able to continue to work from home. So we never really officially shut down. We were just working remotely, and some of them are still home. They have special circumstances, and other people were so very glad to be back, and they returned to work, and everybody has to wear masks unless they're in their private office, and then they can take them off. All of our visitors are wearing masks. We have a lot of DIY masks that people have donated, and they have to put one of those on if they don't come with one, and there's notes all over about that. We've put a screen up at reception to help the receptionist feel more confident. We've ordered the thermometer, or the touchless thermometer, but it's not here yet.
They're on back order.
Yes, there's lots of extra cleaning going on all the time. We've removed a lot of our seating from the lobby, and we've removed all of our upholstered seating and replaced it with plastic and metal chairs so that we can clean the chairs thoroughly after everybody visits. And we've only returned to just the clinic part of it mostly, except for remote for other things. Our staff are not that comfortable with the idea of going into people's homes, but are willing to pick people up from the outside of their home and just work in the neighborhood for O&M. And we're working on increasing our remote training aspects. We've had our very first remote telephonic support group, and it went very well. It was a new stretch for us to do that. So it's going very well. I think people were a little worried, but we ask every week. We have our meeting with the staff and ask them what do they feel that they want to add to our precautions, so that I think people feel that they have had a say.
Yeah, I think that's always the best way to go. And so it sounds like at least two of you are handling it that way, maybe more. I'll just ask, is there anybody that has a policy in place about this that's different than that you'd like to share? No? I can't see all of you, but I think if you raise your hand, it pops up.
Lee, this is Janice Heck from Lighthouse.
Hi, Janice.
Hi. I just wanted to share, in addition to that, we too have been, we feel communication is the key, and we've been in contact weekly with everybody and keeping them informed of changes. But as far as a little bit different, we at Lighthouse, we actually have some thermometers.
Good.
And we're requiring all visitors and guests. For one thing, we're keeping the front door locked so that we can control who's entering and exiting the building. And when they come in, they have to have a temperature check and fill out a screening form, which asks all the questions that we all are familiar with. And so if people have a temperature, or they're showing symptoms, or they've been around someone who tested positive, then they're not going to be able to enter the building or receive services at that time. We also have masks available for guests at the front desk, and of course all of us are required to wear them. But we're also only accepting appointments, and we are using a staggered schedule system with part remote and part in-person services. For example, the low vision clinic will have, say, 2 clients scheduled in the morning, and then in the afternoon, they'll continue to do what they can remotely, while the technology person will work remotely in the morning and then have a couple of clients come in the afternoon. And
That's
so
interesting.
so we're kind of doing a little mixed bag there to make sure we have as few bodies in the building as possible, especially during this first phase of reopening.
Great. Thank you for sharing that.
Yeah, and we're also following like what home health does in the homes with people. So anyone who's over 65 or has an underlying condition that puts them in that high risk category, we're serving them in their homes if they'll have us. And you'd be surprised how many people are open to it. But we're just reducing our times in people home. We're still following the CDC. We're asking those screening questions and doing temperature checks. And you know, we're doing the best we can.
Yeah.
So, yeah.
Yeah, we're building the plane as we fly it. Lois, was your question about the screening form specific to Janice, or you're asking everyone?
Mute here.
There you go.
Asking Janice, she said that she had a screening form that they use, and I wondered if she would be willing to share that.
Oh, absolutely. Absolutely.
Great. Thank you, Janice.
Mm-hmm. Sure.
Great. Okay, Deborah, you've got your hand raised.
Yes, so my first, I wanted to respond to a few comments that have been made about masks. We're getting really clear direction here now in Canada, and in particular in Ontario, from clinical people in our network who, there's some issues. So the N95s, not only are they hard to get a hold of, but they're not necessary for anything where you're not going to be producing aerosols. So when they are going to be producing aerosols, then the N95 is required, which is why they're required in the healthcare system, why they're required in hospitals and clinics where they might be doing procedures that are going to put people at more risk, which is why we don't want to be using them for other things. They're in very high demand. They're also incredibly uncomfortable. They're very hot. Some people find it difficult to breathe behind them, and they have 2 big yellow elastics that go around the back of your head, and it makes them quite tight. And that's all deliberate and needed if you're doing surgery or some kind of clinical procedure where you're going to be dealing with somebody who is coughing or it does have COVID. They're COVID positive, and you have to work with them. what you want to do is think about the surgical masks, which are perfectly fine if both client and provider are wearing them and wearing those correctly. A lot of people put those in the wrong way around, with the colored side in and the white side out. It's actually the other way. So studying up, we're planning to do some training on donning and doffing. If anyone has any accessible mask training videos, things that are well described for a blind person or clients, I'd really appreciate something like that at this end. And then I just also wanted to say that I put a note in the chat about, I texted my optometrist husband when the question was asked about equipment, and got the answer, and I put it in the chat as far as safe cleaning for hard surfaces and optometric equipment.
Thank you very much. Okay, do we have another question?
Yes, there are some more questions that have come in. Let's see. Many of the children we serve are medically complex and are at a significantly higher risk than most. Is this an issue that others are encountering, and how are they preparing for that, I assume?
So I'm not sure how many of you are working with that population, but if you are and are willing to share some tips or suggestions specific to that, we'd appreciate it.
Well, Lee, I can tell you what we've looked at or talking about or learning from.
Thank you.
It's Diane Nelson, by the way, with VIPS. We're not back yet. We're seeing children virtually. We're exploring going back. And in those situations, not having center-based programs initially, but continuing to go to the homes, but then asking the parents if the children could come outside the home. So we're meeting in the porch or the yard or the park or an open air space, so that we're protecting those medically fragile children, but we're also protecting our staff members from what could exist within the home. So that's just something that we're looking at. I don't know if Kathy Mullen's on the call or not, but she may have other insights. These are the kind of things we're concerned with. How fast do we open back up when we know that a child, 75% of the time, if a child has a visual impairment, has another challenge as well. So
right,
we're working on that.
Yeah, good. Anybody else on that particular subject?
Yeah, this is Sassy Outwater. And
Sassy, I can't hear you.
Hang on. Okay, how's that? Is that any
Much
better?
better, yes, thank you.
Okay, so we're serving older adults, and we're seeing a lot of the same things. Most of them have some sort of immunocompromised status, small or large, and so we're not opening yet to do in-home or in-person. We're gonna play it safe for at least a month or two and really go by the Executive Office of Elder Affairs, Health and Human Services, CDC, and DPH guidelines for frontline healthcare workers in the home and in person. It's not worth risking a life for us, of our staff or of our clients. So we're going to play it safe and respect that we don't have enough scientific information yet until we feel safe and until we receive DPH guidelines for how to serve immunocompromised populations.
Thank you, Sassy. Appreciate you sharing that. So I'm going to change gears a little bit and jump to a different topic. And I'm going to ask you to answer this question by going to the bottom of your screen and clicking on reactions. And there is a clapping hand and there is a thumbs up hand. And if you are planning to offer summer programming, camps or summer programming this year, will you please give us a thumbs up? Okay, so far I see about 10 of you. So let's talk about that a little bit. What questions do you have? Pose a question about summer programming.
I have a question about summer programming, and that is, how do you, even if you we're allowed to come back and have in-person summer program, how do you enforce social distancing with kids who are visually impaired?
Who'd like to answer?
Hi, this is Sarah from Lighthouse, Louisiana.
Hi, Sarah.
I'm been thinking about this a lot. I'm trying to plan our summer camp, and our guidelines right now are phase 1. We're allowed to have 10 people in a group. And so that includes adults and kids. And then the groups are static. And so like whoever's in one group has to be in that group always. The kids can't mix in between groups. And so I don't have a full answer, but that's sort of like how we're trying to think about it right now, to adhere to just those small groups and keeping them separate from one another.
Awesome. Can others of you that gave us the thumbs up, would care to share what your plans are? Dina?
We don't have a plan yet. I mean, our plan is hopeful, but we're waiting for our governor to advise us about what we can do. Because she said, is it going to be limited to 10 or 15 or 5? So we're hoping to have our youth in transition and our summer work program, and they'll be separate, but that would require the governor to approve groups of 20 or so. I think we pretty much decided that our younger kids program will not be an overnight program, and maybe not even face-to-face, although we might have some face-to-face later in the summer with the kids, or just a couple of days, you know, maybe some remote, then followed by some daytime for more local kids, if we can do that. Our computer summer courses, I think, are going to be totally remote. So we're like moving ahead like we're going to do it with some modifications, but we're hoping that next week the governor will release his plan for reopening. So we're kind of in a standstill. The same for adult services. We are in a standstill until the governor gives us advice.
So someone asked a follow-up question, and you know, piggybacks on what you just shared, Dina. So I'm going to ask you to do the same reaction button, thumbs up, if you're offering summer programming remotely or virtually. Thumbs up if that's what you're planning to do. So Jennifer Brooks.
I can't find my thumbs up. So.
Dina.
Okay, Dina, Tiffany, Jennifer, Sharon at World Services, Jacqueline in Milwaukee, right, Jacqueline? Jolie Morgan, Ann Celia, Mary Jo Hallett, Margie Van Dez, and Nikki Kissel. That's a lot of you. Unfortunately, I don't have your organization names on the screen. If you want to talk to each other about what you're doing, we'd be happy to put together a little affinity group for you all to just be able to chat about that very subject. If you are interested in that, please let me know in chat and make sure we have your organization's name. So anything else about a specific question about summer programming? All right, let's, I've also had a request to also jump to the subject of orientation and mobility. So we had a lot of interest in how to do this last week. I was kind of holding off to kind of see what happens with the groups that are trying to develop new standards. And that's not going to be an overnight process, so I don't have anything new to share there. But I'm happy for you all to share your questions or suggestions on that subject. So let me know who would like to ask a question. It's 3:36 p.m. In Eastern Standard Time. Anybody have a question?
I just love the fact that the sighted person's using a talking clock, Lee. Mad respect there. You've been hanging out with us blindies for too long.
Yep, starting to rub off. No? Now I thought I saw some questions in the chat. So be brave, ask a question, or if you just have a topic that you'd like to discuss and see how others feel, that those are welcome as well. On orientation and mobility in the state of COVID-19. How do we do it?
I'll respond. This is Dina from the Carroll Center in outside of Boston. So we have lots of conversations with our orientation mobility instructors, and we do a lot of the training for the state of Massachusetts. So we really have asked our staff to come up with a hierarchy of their clientele that they've been working with. So we're not going to be working with people who are living in, nursing homes, assisted living, very large apartment buildings, unless it's a critical need. We have also created the still in draft form, COVID intake form that staff will have to use when they schedule an appointment, but also use within 24 hours of seeing the client to kind of go through the questions of, are you sick? Is anybody in your family sick? Have you left the house in the last 2 weeks? Where have you been? Have you been tested for COVID? What was the result, etc. And then trying to start lessons that are outside, that are not initially in transportation, that are more in open spaces. So that's what kind of guidance we've given them to start once we can start the process. So they're at least now being able to look at that and start to make phone calls with clients now while they're kind of looking at what they're doing. They're creative about using bone conducting headphones with cell phones so they can social distance. We talked about using walkie-talkies or other devices. We have something called a ramble tag, which is a sighted guide device where you're not physically holding on to somebody, using sleeve guards that you can get. But again, it's masks are critical, washing their hands, making sure our staff have sanitation because they won't necessarily be able to go wash their hands being out in the community.
Thank you, Dina. So I will sort of reshare information that was shared last week for those of you that may have missed it. And that is that ACVREP has a subject matter expert group that's always meets. They're the ones that get together to develop the questions for the exams for the comms certification. And they did not too long ago develop a letter of guidance regarding how to provide services in the time of COVID, remote and just safety precautions. So that's on ACVREP's website. I think it's in our Dropbox too at our link. Is that true, Wendy?
Yes, we have there. It's been shared via the Spiel and Steel, but I can certainly make sure it is also in the.
And I encourage you to go to ACVREP's website and check it out and see what else they're working on. And then more recently, the Mississippi State University National Research and Training Center with under the leadership of Sylvia, and she's taking the helm on this with her other team members, are going to use their grant this year, part of their NIDLR grant, to work on standards, research-based standards for remote services and beyond. So again, it's not something that's going to happen overnight, but we are partnering with them to work on that. So once they have structured some of their research, they will be asking Vision Serve Alliance members to participate in that. So stay tuned. I'm super excited as an administrator or leader that's been in this field a long time. While we've had standards for our professionals, the standards for our overall programs have been a lot looser. So looking forward to us all working on this together. No time better than the present. So what other questions do you have? There's 89 of you on here, so surely there's another question. Oh, you know what? Before we do that, I want to share one more poll. Wendy, will you please do that? Thank you for reminding me. She's behind the scenes.
Yes. You want to ask about phased in or sample protocols?
Sure, either one.
Okay. So here it is. All right, should be seeing that.
Okay, so this is a very simple one, yes or no. Are you interested in receiving a COVID-19 reopening playbook? And we are seeking some simple ones that we can share with you, so let us know if that would be of interest to you. And while you're doing that, Diane, were you going to ask something? No? Okay. So who else?
We did have another question while people are finishing that poll.
Okay.
What legal ramifications will we face if one of the kids comes down with COVID-19?
So Wendy,
go ahead.
Didn't you have a little discussion at Spiel and Steel today regarding liability?
Yes, we did. Sherry Racer shared the importance of talking with your insurance provider. And in California, she's based in California at the Society for the Blind, Sacramento, and they had just heard from their state that the state was going to be, then working with her insurance, is going to be able to offer workers' comp to any of her staff that did come down with COVID while they were working, but it would involve a waiver signed by that their insurance company was providing. So it's very important that you work with your insurance company about this.
Yeah, Kathy Zeider had mentioned that as well, that it is important for those of you who are program leaders to have that discussion with your insurance provider, especially if you're providing services in a way that's dramatically different from the way you used to do it. Okay, and so yes, 53 out of 55 would like that playbook, so we will do our very best to share, find some good examples of that and share that with all of you.
We can ask the last poll question that goes with that.
Okay, so if you have already approved your organization's COVID-19 reopening playbook, are you willing to share it with Vision Serve Alliance? Yes or no? Danny, I just saw your question, Danny Moran, and I'm hoping that you will be courageous enough to ask it. I think it's an important discussion topic for our field. Where are you, Danny? Wow, well, I see your question on here, but I don't see you on the screen.
No, I found unmute.
Oh, there you are, okay.
So we have a concern in that, we really feel that the gold standard is to be with people face to face for training to the fullest extent possible. And we're a little bit worried that the state might look at how effective we have been with telehealth and phone services and try to adopt that as what they will pay for because it's least cost. And for the majority of folks that we serve through our small agency, we're relying on state funding through authorizations to serve those people.
Mm-hmm.
Does anybody else? I mean, I know that we need preferred practice patterns. We need to share information about how to do phone trainings and do them really well. It's just a concern that we have that we want to get back to in-person.
Yeah, I think this is a big topic. Who would like to respond? Diane.
Well, I can just say that we were hoping as VIPs that this enables us to prove a tool that works, that's a capacity builder. So maybe 1 week we're in the homes and the next week we meet virtually, because then that 4 hours of road travel translates to 4 hours of face-to-face visits. So we're hoping that it does prove to be successful, but that it becomes a blend. Now, we know best practices is always going to be face-to-face, but in this even more troubling economic time, if you could save costs and still grow capacity. I don't think there's a better answer.
Thank you. Anybody else like to respond?
This is Kathy, Diane's coworker, and I'm going to jump on with what she was saying. We know in early intervention, the most effective and impactful service delivery model is coaching the parent to be the implementer of the child so that the fear factor is decreased of working with your child and being with your child. And that's why it lends itself so well to virtual visits or tele-intervention. However, we also know that it doesn't replace that face-to-face rapport building. So we do hope that the tele-intervention can be used to expand our services, as Diane described, but also enhance them so that families are being empowered more.
Awesome. Thank you. How about you, Jennifer?
Jennifer Bricks. Yeah, we have a early intervention program as well in Tampa, Florida. And we're seeing the same things, and we're looking at the future as well to hopefully use the blended model. My instructors have actually said that some of the rapport building is actually better. I think the parents are feeling more comfortable having the weekly connection over the phone rather than having somebody come out to their house where they feel they have to prep and prepare. And so I'm looking forward to seeing how we can possibly do the blended model like they're saying.
Great. Jennifer Pandolfo, did you have a comment too?
Yeah, I was just going to say pretty much the same thing. We work with mostly older adults, so we're looking to do the blended approach as well and maybe use some of the techniques, virtual meetings as well as over the phone to help our clients who in the past didn't want us in their home for a numerous number of reasons, or there's a sense of having to put on airs to host somebody when they come to your house, regardless of whether they're just a friend or a therapist. So making a pie and getting all dressed up and putting their makeup on, and all of that seems to kind of dissipate. And we found that people are a little bit more willing to open up and have somebody talk to them or help them over the phone or virtually, where all of that is not occurring.
Right. Well, I'll tell you, this is a very interesting conversation. I'm glad that you raised it, Danny. I think it's one that we're all going to be engaged with for some time to come. I think we've wanted to innovate in this field along the lines of telehealth for some time. And I think we'd also all agree that there are some aspects of vision rehabilitation that ideally it's done in person. And so we don't want to throw out the baby with the bathwater. But as the CEO of Vision Serve Alliance, I am painfully aware of the huge swaths of this nation that there are no services available.
Absolutely.
None. And so unless we are able to provide these kinds of services, those people who live in those areas will continue not to be served. And it frankly could open up some new opportunities for the rest of you to serve those areas that have gone unserved. Jacqueline.
Lee, you said almost exactly what I was going to say. We, through this process, have tried to find some silver linings, and because we serve all age populations, we've seen some of the similar things with the families of our young children, in which we've actually seen a lot more family engagement than we've ever been able to get before. Even when we were using the coaching model, families still seem to want to hand off their child to our providers as opposed to really fully engage. So when they don't have that option, our providers keep coming back to me and saying, we want to find a way to continue to do this even after we're able to resume doing in-person services. And then to your other point, for our older adult clients, you know, transportation is a huge barrier. And although we're in Milwaukee, which is a larger metro area, we've talked about the issue of that the remainder of our state, much of which is very rural, just doesn't have the access to the same quality of services that we can offer in southeastern Wisconsin. So we've talked about how do we expand into statewide services, and I think this has helped us to parlay into that a little bit and start to explore how we can be creative in providing those services. So we've been trying to put a positive spin on this and saying that this has forced something that's been on our radar for a while, but has been a little bit of a back burner sort of issue. It's really forced it into the forefront and really taught our providers that it can be done and that there's a lot of benefits as well.
Yeah, awesome. Well, believe it or not, you have just spent almost an hour with us again. The time is almost up. And I wanted to close with just sharing, again, for some of you who maybe aren't members yet or aren't getting the newsletter, just a little bit of news. So I saw some questions or comments in the chat about RSA. And so Vision Serve Alliance sent a letter to Secretary DeVos a couple of weeks ago requesting that she give the authority to Commissioner Mark Schultz to provide greater flexibility in the management of service contracts across the country. Some states are more supportive of innovative models than others. There's questions about summer programming, and I think for the most part what we've heard is that states are trying to accommodate, but we want to try to push that a little bit more. Also, so we submitted that letter. We haven't heard anything in response, but where it is now, if you've got people in your organization who have relationships with your elected officials, I would reach out and try to have a conversation with them about this. Make them understand how this has affected what you're doing with their constituents and why the flexibility on these contracts makes sense and why you'll be able to provide better service. So we will have another call next week. Just another reminder that we have resources available for you. It's in the chat. You can download this chat and save all these notes. If you don't know that, each of you can do that and just save that so you can go back and look at these resources. And we will be back in touch with those of you that would like to participate in a discussion about summer programming. I think that could be a rich discussion. So any last thoughts before we sign off?
I put the link in the chat again for the resource folder, which we will update after this call. Give us a few minutes.
Well, great. Amy just shared something. Oh, I have one last thing that I wanted to ask you to put in the chat. So we've covered a few topics. This thing is still going to change on a weekly basis. So we're planning to do this for at least a few more weeks until we see that people are fairly comfortable with what's moving forward. But if there's another topic or a particular resource or information that you'd like to talk about next week, please add it to the chat. And if you think about it through the week, you can shoot me or Wendy an email as well. We really appreciate you all participating. If there's anybody else you know working in this field, whether they're a Vision Serve Alliance member or not, that you think could benefit, please invite them to join the call. We all appreciate so much what you do every week. Hang in there. And remember, drink as you pour. Take care of yourselves too. I'm gonna leave it up for a little while you finish chatting.
Thanks, Lee.
Thank you.